I'm open to this morning being a little more interactive. So if I do give some explanations and you don't really understand what I'm talking about, please ask for clarity. I am planning on putting Elena on the table somewhat and demonstrating some aspects of treatment. So we'll just see how it all progresses. But we are going to start with a tune-in. So I'm going to ask you all to just take a moment, take a breath, become present. Bring yourself here to this call while the intention of this type of training is mostly to provide information and hopefully to stimulate or help you brainstorm so that when you're working with people, your creativity starts flowing and you're willing to, play with the person you're working with a bit to discover what works best. That is really the intention behind it all. We want to also see if we can, the essence of myofascial release is allowing ourselves to feel. So really just feeling into our own self. If you are a therapist working with someone, it is most beneficial to feel into yourself while you are offering your treatment. So practicing that. If you are someone, a patient or client who receives myofascial release training, you will help your therapist help you by tuning into your own body. Tuning into your own body is the essence of your own healing. And so to empower all of that now into this group setting so that you feel the support. I think it's so important to feel the support of your own awareness, giving you attention. Feel the support of your therapist that's working on you. And now we're going to open it up and we're going to feel the support of this community that is gathering here today. And if you're listening to this, whether you're on the call or listening to it on the replay, you have some type of interest in healing. And so really just opening to the healing community, I think would be even a more expansive experience. There was just a little birdie sitting on a tree branch outside of my window that took off in flight. So we're going to allow the healing energy of birds in flight to also support us today. And I'm truly asking each of you to just tune in, notice what is happening with your breath for beginning. What's happening with your breath? Does it feel tight in any particular place in your body? We're tuning in to where it feels tight in your body, not as a way to judge yourself and tell yourself that there's something wrong with you, but as a way to bring awareness to what might be constricted, what might be holding tension, what might be lacking in awareness. So we're going to enhance that and bring a little awareness to it. It is beneficial. It is beneficial to just feel what's happening with your breath or the lack of breath, meaning where is it tight? Where is the breath not flowing? This is not about trying to make the breath go there. If you try to make your breath go there, you will be using effort and you will probably be enhancing the tightness. So just feel where there is no breath or where there is less breath and it feels tight for you. Nothing wrong with that, simply awareness. And as you give yourself permission to notice where there's a tightness of breath. And as you allow that to simply be present, you may be noticing that something is also starting to settle. So now continue to allow that to happen. You might want to notice your posture. Most of you are probably sitting in some type of chair surface. Some of you may be lying in bed or standing and moving around a little bit. That's all okay. Just kind of notice what your body's doing, moving, sitting still. What's your posturing? Bringing awareness. And now we're going to just settle in and listen to what is it that I am listening for today? What is it that I would like some clarification around? What is it that I would like some guidance or some support? And when something comes to your awareness, give yourself permission to type it in the chat, or I'm also okay if it's easier for you to raise your hand. How do we tell them to do that? Does everybody know that on your participant thing, there's a little button that you can say, raise your hand? It's at the bottom, she's telling me. You can raise your hand and you can talk to the whole group, like ask the question. That's easier sometimes than typing out a question. And so are you able to see if they're asking a question or raising a hand? Because I can't online. Okay. So while we are listening for what is wanting to be revealed today, waiting for who has questions, I'm also going to see what I can start sharing. And that might also facilitate some questions. So I will begin. I had a treatment this morning with a woman who is quite functional in her activities. She likes to do a lot of backpacking. She is in her upper 60s and she's having some constant aching pains in her left SI joint and the upper gluteal crest, so the posterior hip and buttock areas. She has a lot of stiffness in her hips, and basically that was her complaint. So we wanted to see if there was something we could do to help make a difference in that. And I start out with all of my sessions. She was a new one for me this morning, so it was the first time I saw her. So of course I start out by getting a little history on what are they struggling with and what are they wanting from the session. And then I started, she did a demonstration and showed me what she could and couldn't do. And so let me tip this a little bit. So she did show me that she had a hard time. This was all the more she could. And so she was struggling. This was all the more she could bend her foot and bend her hip and get her foot up. So she was literally having trouble with putting on her shoe, and bending over to put on her shoe was kind of adding to the pinch and flaring her up in the back. She did have an MRI and it reported a slight narrowing impingement on the left side of her low back. Okay, so that gives a little bit of information right there. Gives a little bit. I'm not going to diagnose what I'm going to do at that point in time. It just gives me a little bit of a picture. She couldn't see the tightness in my hip, is that what you're saying? So then I proceed to stand them and do a postural eval. And see what shows up. And what we noticed, or what I noticed right off the bat, was she was anteriorly tilted in her pelvis. So should I do it or should I have you do it? An anterior tilt in the pelvis, for those that aren't aware of that, is when your pelvis tips forward like this. So it right away puts a compression and a jamming in the low back area. Your pelvic bones and your hips are what's tipping forward. Frequently, that means there's excessive tightness in the front of our pelvis, in our groin, probably our psoas muscles, which lie deep to the abdominals, and in the anterior thighs in this area, maybe the inner thighs as well. So we noticed that right off the bat. And then we also noticed that she had a torsion in her pelvis. So standing there, her pelvis was tipping to one side, or I don't know if tipping is the right word, it was rotating to one side. And she had shortening in both sides of her lateral trunk. These were narrowly compressed. And she had a lot of tightness in her upper back. Now remember, her history was she likes to do a lot of backpacking. So there was a lot of tension, tightness up in her arms, kind of held to her side a bit stiffly like this. So think about upper back, shoulder blades, back of the ribs. Think of all of that area. When that's holding and blocked, it's going to also create some holding in your hip area. So symptoms were showing up here in her back, really more her left side, but also tightness in through her groin, she reported. Symptoms were showing up here. But in myofascial release, we always say, find the pain and then look elsewhere for the cause of the pain. So this, to me, would be an area that I would want to address a little bit further, or at least assess, check out and assess. Okay, so what did we do from there? So then I watched her do a forward bend, and she bent forward. She could bend forward, but it was stiff looking. It just looked stiff. She didn't easily flow down, and she went about halfway, and about at that point in time, her trunk started shifting to the left, just slightly, but you could tell that the left side was tighter, pulling her to the left. Let's see if I can even demonstrate that. It looked something like, as she forward bent, let's see, it'd probably be better if I went like this. She went like this. Let's see, she was in an anterior tilt. She went like this, so she kind of went like that, and she listed to the left. Can you see that? Let's get some interaction from the crowd. Let's see, what do they say? They say, raise your hand if you can see that and have a sense of what's happening. Is this a question to read, or? It's just, okay. So, okay, so that tells me, right, if she's forward bending and being pulled to the left, what does that tell me? That tells me that she's shorter and tighter on her left side. Something is pulling her into that contracted positioning. Okay, so then I put her up on the table. I take a look at her up on the table. She definitely has her asis on the right is much lower than on the left. So she has a torsion of the pelvis. Her right leg length looks longer. And then I also did a little bit of movement of her hips. Definitely her hips were tight and tense. She could not pull her knee all the way up to her chest. It was more like 90 degrees of hip flexion. So I don't know, should I demonstrate that, or is that even important? I don't know if it's important. Yeah, you guys have to tell me what's important to you and what's not. See, you guys have to give me some so we proceeded then to work on so her pain was on the left side of the back of her hip. We proceeded to work on the front side of her hip, right in through this area. On the right, yes. I don't know if you can see that I'm on my right. This is my right. So we worked on the right side of the front of her hip. But then I just started feeling into her body. So maybe this would be a good time. Let me show them what I did with you. I think that might be more valuable than me trying to talk each detail. Yeah, or even just that tank top would work. Okay, so give us a moment. And as we're taking this moment, just kind of reflect on what else is showing up for you. Was the restriction opposite the pain? Okay, that's a really good question. Was the restriction opposite the pain? So it's going to have to be through this, right? I don't need that on anymore, do I? Okay, so you have to figure out the camera. How do you want? What do you want? Yeah, you put your head that way. It's familiar. So there was a restriction that was opposite her pain. Can you guys see okay with the window in the background? That's good enough. So she had pain on the back left. She had a restriction, but remember, everybody has more than one restriction in their body, but she did have a major tightening. She had tightness on both anterior hips, okay? But she had more on the right side. This is the right side. I don't know if it's backwards when we do Zoom, but so this one was rolling forward more. So it was shorter over on this side. So that's where I started. I started by doing some cross hand releases here. However, before I started that, I was still assessing. And one of the ways that I was assessing, you want me to take that, is I put my ankle a little more towards me, my hands, So I was to feel the upper back area too, a little more turn. Yeah. So I put my fingers here, roll this way towards me, roll all the way. So my fingers are like this on her back. And I'm kind of doing this. I'm just assessing mobility, but I'm doing it with her laying on my fingers. So come back. So here I am. Yeah, that's good. I'm assessing mobility. I'm feeling how much do those ribs move? This is her left side, now her right side. How much do those ribs move? And depending on who I'm working with, I'm a little firm right now with Elena, because this is Elena, by the way. Everybody say hello. So I'm a little firmer with her because she can handle it. And the person I worked on this morning was also firm up and through here. So I'm just feeling, where is there give in the ribs? She has give over here on the right side. And she's a little stiffer right now here on the left. You can just feel as I go to bounce, there's no bounce. And then I just kept feeling my way down. I got down into her low back, and she was really thick and stiff over here on the right. So think about that for a moment now. She's being pulled forward here. Her pelvis was torsion. That means her, that's smarter. That means, except I can't see it now. That means her spine is torsioned. So she's rolling. Let's see, wait, I think it was the opposite. No. So she was thicker, much thicker over and through the right side of her back. And I could feel that immediately. This pulling it forward was creating that roll over in that direction. So what else do we want to do when we're working on opening up the hips? I assessed how much she had hip flexion. Now she went about here. Elena has much more. Elena has great range. She can go a lot further. This person I was working on went to about here. Her hip just kind of went when I went to move it. I'm like, okay, that's enough. I checked a little bit of gentle hip approximation. And I also started to feel the tension was just showing up in her inner thigh. Now, she already knew I was going to work in her groin area. It's actually what she came in asking for because her naturopath told her that that might be helpful. So we're working on the inner thigh. It's a personal area for many people. I was going to explain that to her. I'm going to feel through your inner thigh. I'm just feeling for how much give is there, how much restriction, how much tension. But I told her I'm going to work my hand all the way down towards your inner groin. If anything doesn't feel comfortable, please let me know. Always important to explain and get their permission. And she had a lot of thickness in this inner thigh. So I left her leg in this position. I asked her to allow me to hold her leg, and I just let her sink and rest. And then I put my own hands and just did a gentle squeeze where she was the thickest on her inner thigh. I got her feedback. So let's say she said, oh, about right there. She said, I'm starting to feel it in the back of my left area where I feel the pain. I'm starting to feel it there. So in myofascial release, one of the principles is wherever we're working, if we are reproducing their symptoms, we know we are on part of the problem. So rarely does a person have one restricted tissue that solves their problem, right? So it's not about us trying to find that one specific spot and resolving it, although the more we get to the key areas, of course, the better. So we did some work in there. Did you get all the way to the groin? I did, but she didn't have as much. Hers was more in like the middle of the groin. Put it back down, reassess, looked for balance. Okay, so her ASIS started balancing. Her leg length started balancing. So then I go, okay, what's now showing up? What's showing up next? And there was still this kind of torsion area, and there was a feeling up in her iliac crest. So I started palpating around her iliac crest, because this can also refer a lot into the hips, the iliac crest area. So I started palpating around these areas, and I compared both sides. I wanted to know how it was different, but I also wanted her to feel the difference. And you also have some differences. Almost everyone has some differences. In fact, if you take your own, let's get interactive here now. So if you take your own hands, doesn't matter if you're not a therapist, you're going to treat your own body. We all want to be able to treat our own body. Mm-hmm. So take your own hands and this is your iliac crest. It's kind of like what we call the waistline. Feel along the top and the inside of that bone. Stick your fingers into the tissue. It's thick tissue. You will either feel like, oh, that's just kind of thick, maybe a little numb, like you don't really feel much, or it'll be like, ooh, a little tender. And feel it all the way up to the sides. Both sides, and you'll start to feel your own differences. One side will feel thicker in the same area than the other side. So you'll feel your differences. It's super therapeutic. This is a super great place to start doing some treatments. It will help your low back. It will help your hips. It will help your digestion. Because what runs near these areas, the ascending colon starts out, comes up, across, and then descending colon down here, reverses back into our sigmoid colon and then into our rectum. So a lot of tightnesses, twists, and turns, restrictions in this area can make a big difference in your digestion, not just hip and back pain. Okay, I want you to feel around in there and see if anything comes up. Any questions? Somebody put your hand up. I want some interaction. Should I treat you while I'm waiting? Sure, I totally can feel. Yeah, you were thick over here now. I'll see and listen to the collective energy and hear what questions come to me telepathically. For those of you that aren't quite sure how to form a question yet. So it's thick, and I'm just going to sink. So I could be right on skin, but when we're doing direct pressure, which means I'm taking my fingers directly in, it's okay to go through a piece of clothing. It helps soften if you haven't filed your nails. Helps with a little more softness. It's just as you can be just as effective. So you just sink in until you feel like you can't sink anymore. So I'm coming in and out just to show you how far I'm in. I wouldn't normally, I might do it a little bit, but I wouldn't normally keep coming in and out. So just showing how far I'm sinking. So you have a little more visual feedback. And right there is my limit. It's the tightest about right here, but I'm going to use my other finger so it's not so pokey. And I'm going to, are you inside of asis? No, I'm up higher. So the question was, here's her asis right here to give you a sense. I don't know how you feel about showing your body. Are you comfortable with that? Or? Okay, so here's her asis right here. You notice how pretty good size that bone is, right? When we're assessing for asis alignment, we always go under the bone so that we're actually bumping up into it. We don't measure on top of the bone because it's a good sized bone and I could pick and choose and it wouldn't be consistent. I wouldn't have consistent results. So always underneath the asis. So here's the asis, and then I follow it up to the iliac crest. So I'm up here now on the iliac crest. Up in this area is where this lovely patient has the most restriction showing up. What if they're ticklish? There is the question. That is an excellent.
I am.
She's clenching. Okay, so excellent question that will serve this lovely patient right now too. Frequently, they're ticklish here. Frequently. So this type of work is not indicated. I wouldn't keep going in and out. You just have to let them giggle. Like if they go, oh, I'm ticklish, you say, oh, okay. Sometimes I say, put your hand on top of mine. So like if let's say I'm ticklish, so go ahead and let yourself be ticklish. Okay, so I might say, oh, all right, so take my hand. Now they've got a little sense of control in the situation. And let's approach it together. She's still going to probably giggle or tickle, but it's a little easier. And I just say, okay, let your body respond. Just let it respond. As we sustain pressure, it will dissipate. Yeah, it will dissipate. And sometimes, that is an old emotional restriction that needs to come out. So there's nothing wrong with letting them giggle a little bit on your table. It's a lovely thing. Okay. Do you assess the upper cervicals given the symptoms are SI joint? Treating the dural tube about the occiput atlas C2 say, is dural tube a large player in her symptoms? Okay, well, possibly the dural tube is a large player. Yes, I do assess the cervicals. Was that the question, cervicals? Yeah, I do assess this. I assess the whole body. But when somebody comes in and has a 1 hour appointment, and part of that 1 hour is just first getting to know them and them sharing their story and doing a postural eval. I am going to pick and choose a little bit about where I'm going to go. So with some people, I might start and put that right in the assessment. With others, she was fairly this particular patient was fairly fixated on her naturopath telling her that she needed pressure points in the groin. So with one session, I don't want to get into I want to just kind of go to the focused area first, but I right away said to her, your shoulders are tight and holding, and I think they're contributing to the whole aspect, which led her to ask if her backpacking was making her worse. Or no, she asked if backpacking was causing the problem. And I said, no, I don't think it's causing the problem, but it's probably contributing to the problem. So whenever we assert our bodies in a certain way, then, we're taking out the, let's see, what am I trying to say here? We're pushing our bodies a little more to the edge. More is going to rise as far as the dysfunction, right? So if we limit our activities, we may not notice as much dysfunction, right? But we're limiting our activities. So if I were going to see her ongoing, I would definitely also incorporate and work with that coming up. Ongoing is what I would say. So yes, but I didn't specifically do it for that session today. Is the answer. Good questions. I appreciate them very much. We can also, I just want to put it out there, your questions can be about anything in your own body that you feel you're questioning. And while I probably can't give you anything definitive over a Zoom call, we can stimulate some creativity, brainstorm. We have the collective community energy, and we might get some new ahas that show up, right? You can also ask any questions about any patient you feel you're working on and you just feel a little stuck. You're not quite sure how to address them, or you're not quite sure maybe what's happening in some of the situations that you're working with. It's okay, we can give it a moment. So I'll shift the subject a little bit and talk about some other patient scenarios. I am teaching just a 1 day at a facility coming up this weekend on what is the pelvic floor and how does it impact our patient population in a physical therapy rehab department. So I happen to be just spending some time, I'm going to tell a little personal story now and out my mother. I happen to be spending some personal time with my mother recently. She is 91. She has had 7 children, and she is now struggling with some incontinence. She would not want anybody to know that. So, she never had any problems with it until 2 years ago. She fell and broke her foot. So I just want you to start thinking a little more broader now. I'm going to talk a little bit about pelvic floor health. So so she fell and broke her leg. She couldn't weight bear for 2 months, and then slowly brought it back. She still has much less function on the left side than the right. She moves very slowly. She uses a walker. All of these aspects. So, being 91, my mother didn't want anything to do with any type of internal work, and I wanted to respect that. That's a very personal, private issue. I wanted to respect that. However, I did remind her that I'd already been there once in my birth. I had passed through that area. She had said no up until that point, but I did go to a doctor's appointment with her, which they were going to start her on a medication. And the doctor did say to my mother that it would be wise for her to let me try some pelvic floor work. So my mother then agreed because the doctor said that to her. And I have to say, the first time that and she's also been really dealing with a lot of edema, swelling and edema in the leg where she broke it. And so I went in and did an internal pelvic floor assessment. She was so congested on the left side of her pelvic floor. She had room on the right. She was totally congested on the left. And I felt like that. There's so much compression going on in her blood flow that serves down her leg that would make a very big difference. So the next day, she actually had some releases that went on and happened for her. And the next day, she had her continence had restored. She made it to the bathroom every single time for that day. And she had much less swelling and improved coloration in her feet and legs. She's still not very stable. Like if you looked at her when she tried to walk without her walker, you would be concerned that she's going to fall any moment. And she doesn't walk with ease, but it made a difference for that day. Nighttime was a different story. And the next day was a little less, but still better than it had been prior to that. So I just started working with her then on some little gentle exercise in the area to see if she could try and activate a little bit more in that region of her body, in her pelvic region. So what did I do with her in that situation? I just had her do some simple, she was sitting in a chair rather than on the table, but I had her do some just simple, press your hands into your legs and see if she could squeeze in her pelvic floor region. So we just played with that for a little bit of time just to help her get a little more sense of control, right? Continence is all about our ability to control so that we have choice in where and when we eliminate. And incontinence is a huge issue, definitely more common in the elderly, but it is also can even be an issue in children. I mean, obviously before they're potty trained, that's an issue, but in children it can be, but even in high-level athletes can have a lot of problems with incontinence because they are overly trained and overly tight in their pelvic floor region. And one of the aspects that we want to consider is more relaxation so that there can be some lengthening in the tissue. Our pelvic floor muscles are muscles just like in the other places of our body. They need to be able to contract, but they also need to be able to relax to function properly. And what we're learning more and more and more is that it's the relaxation phase of the pelvic floor muscles that is the most lacking rather than the contraction. So we used to think it was because everybody was too weak. And now that is the case in some situations, that is definitely the case. But in many situations, the problem is that they are too shortened, so too tight, too shortened. And as any type of short, if the muscle is too short, you no longer have functional capacity. If I couldn't lengthen my bicep all the way down, if I was acted, did the decision, I would only have this amount of ability to use it. So it's the same thing in the pelvic floor. If we're overly contracted, it's lost its ability to provide the resilient flexibility that it's designed to have. Which, there might be questions around some of that, but which takes me back to the case story with my mother, in that sometimes our feet, the flexibility of our feet and how our feet hit the ground when we walk has an impact on the supportive capacity or the supportive function of our pelvic floor muscles. Is that clear at all? Is that clear? So I can explain that a little bit better, but let's read the question. I have heard feet can influence pelvic floor. I have my shirt. Yes, absolutely. They're seeing that more and more now. A little weaker on left leg. What can I do? Okay, so let me finish about, so if there's no adaptability in the feet, right? So there's a rigidness in the feet, that's going to be translated up their leg. And what's going to take the impact then? The feet are designed to have adaptability as we walk on uneven surfaces. If we've lost that adaptability, bling, there's going to be vectors of force that come up, and the pelvic floor then has to lock up. So treating somebody that might have some incontinence issues, there's more to the pelvic floor than incontinence, but you might check the mobility of their feet. All right, so you can work with people without thinking that you have to do internal work. That's kind of my whole point. That's whole story. Think about some aspects. Now, do I think that doing internal work can offer more relief and more benefits? Absolutely. There's no question about that. Absolutely. Okay, so my 92-year-old had a mild stroke a year ago. Only residuals, a little weaker in left leg. What can I do? Well, okay, that's a good question. So, I mean, it's about rehab. That is about rehab. That is about exercising. That is about training. But oftentimes when there's stroke or anyone, you do need to do a little, hold up. You do need to do a little facilitation because they just don't have the sensory input any longer. So anything to give them, I think I talked about this in my last Q&A. So this is now a nice demo. So you might start with some tapping. You might start with some tapping, rebounding, or just rebounding, depending, just to let them see if they can feel the movement. This is what we call rebounding. Usually I don't recommend tapping rebounding. It could be a little bit annoying, but for somebody who needs a little more stimulation, you might do that. And then you might say, okay, now let's see if we can do some exercise. See if you can slide that up. So depending on how, you might have to assist that movement. And then you might let them slide. And I don't know if you can, I don't know if they can actually lift their foot off the bed. They might just do slides like this. Depends how functional. You know, everybody's going to be different, right? And then you might also have them, give them a little bit of resistance so that they have to push a little. So I might give a little resistance here and a little resistance under the foot. And it's about how much can they tolerate. You know, for some people, especially if they've recently had a stroke, but anyone, they might only be able to do 3 reps. For some people, they might be able to do 10 reps and they might handle more pressure, more resistance. Just depends what you're working with. But then also, you know, resisting in and out. So can they move this? You might have to help them move it, but you might give them some resistance in and out, right? That you could lay them on the side, have them do some resistance. So whenever you're working against gravity, so if she were trying to move that in and out, that would be easier than if she were laying on her side and had to lift this leg up toward the ceiling. That's a harder exercise now because she's working against gravity. And if I resisted her, of course, that's like adding a weight to it, or if you put a little weight on it. Sorry. So you can also do release work or traction work with somebody. Be careful how much their stroke about the track. You wouldn't want to do heavy traction because you just don't want any, you want to be concerned about any type of subluxation. So how much is their joint stable? Proximation, which is a little more compression, tends to be a little more stimulating to get their body working for them again. But those are just some ideas. See what else comes to you, other ideas. I have a client with Forstier's disease, which is a thickening ossification of soft tissues. In this case, her hips. I've been doing some scouring in conjunction with other MFR techniques, which seems to be helping. Anyone with good outcomes with this? Okay, so good. Let's put it out to the community. I love that. So here's what she said she's been doing. So she's getting good results. So of course, whenever we're getting results, keep doing it. So you can do some support their leg. You can do gentle compression and just kind of check for range of motion and where does it seem stiff. Or we can take our hands back down into close to the hip joint. We can give them a little traction, try a little range of motion movement that way. You can just traction it, lean back, get yourself comfortable so that you're not using all of your arms. You're just in a place or you're resting. But we're asking for those of you in the community now. Anyone worked with somebody like this and had some good outcomes? Want to give her a little encouragement or little suggestions? I think Doing some gentle rebounding could also be very valuable, because what is that doing? That's helping stimulate the fluid flow, getting some blood flowing in there, lubricating the joints. Definitely releases all around that. And also, like the comment earlier, the dura. So the dural tube, the spinal cord. So what's happening with, what's going on with the soft tissue that's ossifying? Could be that there's a holding pattern in their nervous system. There could be where you just want to maybe give some support to both sides of the hips and ask them to tune in and feel, just like I did with you guys this morning. Just tune in and feel what's happening inside of your body. Seeing if you can feel, maybe there's a holding. It's like I had you tune in and notice your breath. You could do that with them as well, but you also just might say, just see if you can feel into your hips. Now, if there's a thickening in the tissue, it might be hard for them. But to me, that tells me that their energy is not very present there. And so their body is having to thicken in order to give them the support. So I might think they're not really in there very much with their energetic presence. So I would check that. So you might just start by resting and doing a lateral transverse plane and just asking them to feel what's happening inside of your body there. Can you feel in between my hands? It might be hard for them to feel that right off the bat. So that's where last time I talked a lot about facilitation techniques. That's where you might start with a little bit. Can you feel me tap you? Can you feel me tap your right side? Can you feel me tap your left side? And just take them back and forth with their awareness. And that might be too fast for somebody. You might, and then you might even jiggle it. Can you feel that? And then rest. Let them see if they can feel that. And then do it on the other side. And then see, and then it's working with them individually. So can they feel it or not? If they cannot feel that, I would start using a little more pressure. So I might use a little pokey diggy pressure. All right. Can you feel that? Only I can feel that. And then start to slow it down where they can feel it with just me resting there and tuning them into this part of their body and helping them learn how to feel the inside of this part of their body is gold. I mean, it's essential. It's what's needed. But just saying to somebody, okay, feel the inside of your body, like, okay, what does that even mean though? I don't know. They don't know. They need coaching. They need coaching on how to feel that. Okay, I can't find the next, there was another question, but. All right, so let's just take a moment. Anybody wants to put their hand up and talk and give me a break? Take a moment and with all of this information I've been blabbering at you, see again, let's tune in and see now what's happening with your own breath. What's happening with my breath is what you'd ask yourself, but I'm not asking you to see what's happening with my breath. I'm asking you to see what's happening with your breath. So just see, is there anything that's shifted from what you noticed initially? I think there was another question. Okay, good. Thank you. Thank you very much for your thank you. Thank you for this demonstration. All right, it helped open up your senses. So keep feeling into your body. Notice as I start to ask a question, just see if there's some kind of intuitive insight that might come to you. And if not, you're listening and you're receiving. You don't have to grasp all of this information. Something is going to flow in so that if you're the one on the table, when your therapist is working with you, you'll all of a sudden be like, something's just going to shift. It's just going to shift from your experience of being here today in this collective. Or you might go, oh, that's what Lori was talking about. And as the therapist, the same thing. All of a sudden, you're just going to maybe feel a little more freedom to try something in a new and different way than you have before. Okay, I see your question. How do you handle different types of tissue elasticity? For example, sometimes the tissue feels malleable in certain people and others feel like rubber. Yeah, that is a really great question. So how do I handle that? I definitely vary my pressures according to what I'm feeling coming from the I'm going to say frequently, that's part of my assessment. So when I'm working, whether I'm already in the giving a treatment or assessing what's happening with tissue texture, the question I'm asking is, what is this tissue texture? So what does it feel like? Okay, it feels a little boggy or mushy, or it feels a little rubbery. I'm a little bit bouncing off of it. Or wow, it's really thick and dense. So I'm asking myself to kind of describe it to myself. I'm listening for that. And then the next question I have is, so what does this tissue need? Well, then that requires me to sink back in and listen again. What does this tissue need? So I might be kind of assessing what's the tissue feel like. And with that assessment, it's like how much pressure is the most receptive to that particular area on a person. Now, I'm always treating a person, right? But the reason I didn't say how much pressure is receptive to the person is I believe every one of us needs a variety of pressures. Sometimes it's like, oh, I got to back off. Like I'm still touching her, but I'm kind of pulling my own energy back. I'm even pulling back my intention of pressing into her. I'm pulling that back. So my pressure might be staying the same from my perspective, but the energy within the pressure is shifting. So if my mind is saying, I got to get it to release, that's going to have a different impact on her than if my energy is saying, oh, I've got to get out of the way a little bit more. And I don't want to leave them on their own because that's why they're coming to see me. So I'm just going to back my own energy up a little bit so that I can give them space, give their energy space to come in and do the healing because they heal themselves. I'm a facilitator. And to get my own, to receive, so that I'm now receiving what's happening in the responsiveness of her. Now, everybody works differently, right? Everybody works in different ways. You might hang out there and really wait, give it permission. Might take time. So you're just giving it time, but you're there with them. You're just there with them, hanging out, paying attention, but hanging out and listening and receiving. You might feel like maybe you get lost in a moment. You're like, so you might give it a little more time, or that might be saying that, okay, their energy went bye-bye. So maybe once in a while, you kind of reassess again and you nudge and say, okay, what's happening in there now? What's happening? Sometimes when it's really thick, it needs action on their part. So like that question about the ossification of the tissues might be that they need a little action. So I might then ask them to see if they can feel my pressure, and maybe see if you can press back into me a little bit. And this is what I refer to as fascial energy activation. And I go over a whole day of this in my fascial connections seminar coming up in September in Sedona. And I'd love to see as many of you that wants to come. And just kind of working with them. There's a way of working with them with that tissue that helps bring their awareness, helps bring their energetic presence into the tissue so that the fascial system doesn't need to overwork and do what their energy and their presence should be doing for them. And it can help create a shift in their nervous system. So the firing of the nerves coming back and forth, it can just help by bringing that presence in. Makes a huge difference. It's time. Oh, it's time. Oh, this is so much fun. We're all at the end of the time. Okay, so thank you for that. So there was one more question about, or she was just making a statement. I think it was in reference to the patient that had the stroke. She said she also had edema in that leg. If the leg is not moving as much, if there's compression, fascial restrictions, compression around the blood vessels, arteries, the veins, you're going to have edema. So movement is important, even if it's passive movement. So you moving them, that's not always practical in many situations. That you have help that will do range of motion exercises with them. It's just not always practical, but the more you can do that, the more they can do some movement, the better. The more you can do myofascial release, which helps take pressure off of the compression. Remember that blood vessels have fascial elements in it themselves, but also run through the fascial web of tissue. So are susceptible to compression, and that limits the flow. Might also limit the pumping mechanism. Okay, I hope that stimulated some further awareness, maybe even brought about a little more connection to yourself as you treat or receive treatment. And maybe next time I get a little more verbal interaction, I'm going to start encouraging that a little bit more. But I would appreciate it if you give me any feedback on having the demo, if that was valuable, or what you might want to see the next time we do this, what else you might want to have some insight in, and even if it was too much jumping around versus maybe just taking one theme and sticking with one theme. You know, we all learn a little differently. So any feedback you'd like to give me, I'm very open. I'm receptive. I encourage you to be a little receptive for your own self today. So receive from the ground, receive from above, and just practice today listening to your own breath. There will be so much value that will come in just listening to your own breath. So many blessings. Have a lovely day, and thank you for joining.